IUDs are intrauterine devices. So most of us would understand only if we say copperties. Okay, copperty is the most common reversible contraceptive used all over the country. Okay, if you go to the government side where we all worked, it is the most preferred method of contraception. Most of them don't want their tubes to be tied, and that permanent method of contraception is not liked by many women. So they prefer to use a copper T. So the IUDs are of two types. One is the copper T, and another one is a medicated IUD, which is called as the Mirena. Mirena is a brand name, actually. So what does the copper T do is it directly sits on the uterus and prevents the egg and the sperm meeting. Okay, so this is a very, very effective method of contraception, and almost it protects from 98% of unwanted births. Okay, so there are various types of copper T. One being the commonest being the 5 years copper T, and then the 10 years copper T. If you go to in the government side, mostly we use the 10 years copper T. See, this 5 years, 10 years is the validity of the copper T. It does not mean that you have to keep it for 5 years or 10 years. Like any day you want to remove the copper T, the next day you have all the chances of becoming pregnant. So that is the most important thing. See, one, it is very effective. Second, it is a fit and forget method of contraception. Like once the copper T is inside you, you don't need to remember every day that, okay, I need to use a contraception. It's like you fit it and you forget it. Okay. So it's like very, very much preferred by many ladies, because not everybody is very keen on taking a pill every day, and many of us are very forgetful. So that is one advantage. And actually copper T is a good method of emergency contraception also. See, as I already told you, emergency contraception pills can act only 3 days after the unprotected intercourse, but copper T, when you put inside even after 5 days of an unprotected intercourse, it can act as a very effective emergency contraception.